Hi, welcome to the NHS. A career in the NHS is a really good career. There are lots of different opportunities, there are lots of different fields and specialties that you can go into. Please listen to some of the stories that our staff have given on the video today. Please talk to anyone here today, any of your university tutors or your college tutors, and find out a little bit more about what careers we can offer in the NHS today.
Rachel Nolan, Clinical Support Facilitator. I support healthcare assistants coming into post, so I work alongside them on the wards, helping them to understand what they're doing and why they're doing it. So if a patient becomes unwell, they are confident into escalating. I also deliver teaching sessions around clinical induction, so when they first come into post, they receive the education required to be able to then get going on the wards.
My name's Dawn Parker and I'm a community HCA. It's very versatile. I get to work in the community, out and about, working with patients in their homes. I usually go into the office in the morning to pick up the visits that have been allocated. There can be anything from dressings to compression bandaging, to taking bloods, to giving injections.
One day is never the same, it's always very challenging. I joined the team in January and I run the clinics in the hospital, which are catheter clinics, leg ulcer clinic and the PIC clinic.
In that instance we're able to invite these patients in with leg ulcers that sometimes are very upsetting for them and restricting their sort of lifestyle. The thing that I get most out of it is actually seeing them on a regular basis, seeing the wound change and heal.
And it's the support we give to the families as well as the patients and the feedback we get from the families, which is really, really good.
My name is Marie Mace and I'm the Clinical Placement Educator and Return to Practice Lead. Okay, my job role at the moment involves mentoring and looking after student nurses and their mentors while they're in their placement here at Torbay Hospital and also in the community. When I get into work, I want to check to see if any of the students have been in touch, if there's any mentors that need any supporting, and to get in touch with them as quick as possible, really, to provide them with the support they need.
There's obviously mentors, there's supportive colleagues on the ward, and there's also training and development that can be done through Torbay Hospital, and you have to learn communication is obviously important, and interacting with patients and being an advocate for patients is always very important.
Having that team around you in the early stages of my career to support me and to help me with my development, and now for me to be able to see staff developing, moving on into different roles, taking on extra responsibility, it's really great.
Basically, I've always worked in kind of care from when I left school, and I felt that it was something that I wanted to do, give something back to the community and people and help people, so that's why I decided to go into nursing.
Well, I started working for this trust as a ward clerk, and I did that because I thought I wanted to have a taste of the NHS, so I came in and developed myself as I was a ward clerk and applied to do my nurse training, and was lucky enough to be supported by Staff Devon Healthcare, and then I progressed through my training, became a staff nurse in the emergency department, and then progressed to being a sister.
I started off doing HCA work. I worked in a private hospital for 7 years, and my manager helped to persuade me to try to do the training, the interview for a nurse. I got the interview and that was it.
Well, I was a carer for Devon County Council for 10 years. I worked quite often with district nurses that used to visit patients, and from then on I just decided that that's something I would like to try and get into. So I was able to complete a Diploma 3 in Health and Social Care with Devon County Council, and I was able to then apply for the job for a Band 3 HCA in the community.
Do you know, I absolutely love my job. I feel privileged to be able to work with patients, and I chose a job in education because I wanted the students that come into this profession to have the same passion and the same commitment.
I love being on the wards, I love working with all the nurses in different environments, I love working within the clinical education team. Everybody is just so supportive and everybody's really fun to work with.
Yeah, and it's the variability, there's just something different every day. You never know everything, something always comes up that you have to stop and think about and learn.
It isn't a job, it's something you want to do, it's something you need to want to do.
We see lots of positive things come from our patients. They come in quite disabled and end up going home walking. It's quite rewarding.
It's great working as part of a team and also being able to develop yourself further as well.
If you have courage, if you have commitment, if you want to care, if you want to be around people who will nurture you and move you forward, then healthcare is for you.